Dr. Francis Collins, the former head of the National Institutes of Health and a science advisor, even to the current administration, has admitted that he and the others at the NIH made a mistake in not giving any weight to the collateral damage caused by the agency's response to COVID-19, basically admitting they had blinders on. They didn't care what it did to the kids psychologically, didn't care what it did to the economy. They were just wanting to make sure they stopped the spread. Well, Collins worked to orchestrate a devastating takedown of the scientists behind the Great Barrington Declaration, which said that harmful lockdowns could be avoided. I mean, basically, science is supposed to try all these different things out and listen to competing voices, but they silenced them. But he did not acknowledge that that was a problem. So where do we go from here? Are we going to see the same thing in a future pandemic? Well, joining me now to discuss this and more is Dr. J. Bhattacharya, professor of health policy at Stanford University and one of the authors of the 2020 of the Great Barrington Declaration, which advocated for an alternative approach to the COVID-19 pandemic. Dr. Bhattacharya, thanks so much for joining us. Happy New Year.
Happy New Year.
Now, let me ask you this, because you were probably at the top of the totem pole when it came to those being targeted by the takedown by Dr. Francis Collins, where they attempted to silence you on Twitter and other social media platforms. Are you surprised by his admission that surfaced this week and has gone viral? No pun intended there?
I mean, I'd seen it actually. I think it was an interview from a few months ago. It finally caught the attention of the public. It's not surprising that he would have some regrets. Anyone that has any amount of intellectual honesty about the failure of our pandemic response and the devastating harms that it has done to the poor, to the working class, to the vulnerable, would say that that was the case. The issue then is what to be done about it now. If you listen between the lines, what he wants is basically like he just wants to move on as if nothing really happened. He doesn't really apologize. He wants to pretend like what we were proposing at the time was somehow still dangerous. He even says that in that interview. What I'm afraid, Tony, the situation we find ourselves in is that there's pretty widespread agreement that our pandemic response was an utter failure, but that the people that designed and implemented it, people like Francis Collins, that abuse their power to conduct devastating takedowns of scientists that disagree with them, they're giving themselves awards, pats on the back, and they've sort of cemented in place the kind of the architecture of the lockdowns that they implemented. And when another pandemic happens, we will do it again.
Well, that's exactly right. That's the concern, is that there's no acknowledgement that this was an utter failure by those who are pulling the levers. And so I'm left to believe that we're going to see, despite the mounting evidence, for instance, we're seeing, expansion of different sicknesses and illnesses because we do not have the immunity that should have been built up from COVID and other infectious diseases because we had everybody locked down. Despite all of that, there doesn't appear to be anywhere on the horizon a different approach being discussed.
I mean, I think it's going to take new leadership because I think if you think about the scope of what the damage that was done by these decisions, countless children who lost their birthright to an education, especially poor and minority kids. You look at the learning loss numbers, depression at tremendous levels in young people, cancer diagnoses that were delayed as a result with people dying of cancer that should have been picked up with screening earlier, heart attack rates from people that had been stayed home instead of like going to the doctor when they should have early in the pandemic because they were so scared to go because of COVID and because they were told it was, the countless millions of people who starved as a consequence of the economic dislocation caused by lockdowns. All of those people need a voice, and they don't have one in the current sort of leadership. It's going to take real leadership committed to an honest evaluation of what happened during the pandemic, and then a commitment to reform that puts in place strong protection so that people like Francis Collins do not have the kind of power they have to essentially impose their scientific view in a sort of dictatorial way without checks and balances.
Dr. Bhattacharya, let me ask you this. I know we've talked about this before, but sometimes we're hard of hearing and we need to hear these things over and over again. Let's talk about the average person. What can they do to make sure this doesn't happen again?
I think it is very, very important that every single public official, from dog catcher to the president of the United States, be asked, what would you do in the next pandemic? Would you include a broader set of voices? Would you engage in censorship? Would you rely only on high-level science bureaucrats with conflicts of interest, or would you include a broader set of voices? Would you respect the American First Amendment? Would you sort of put healthy people in quarantine without any recourse? Would you close churches? Would you close schools? What would you do during the next pandemic? And then vote accordingly. Because if you don't hear a solid commitment to a much better response, one that respects liberties and respects rights, that actually would have led to a much better health response, then you should just vote for somebody else.
Very, very good recommendation. Good suggestion. Dr. Jay Bhattacharya, thanks so much for joining us. Always great to see you. And again, Happy New Year.
Happy New Year. Thank you.